everyone to a wonderful episode of your John's Podiatry. Case update, we have a young patient who presented to our office with a chief complaint of very ugly corns and or calluses to both fifth toes and also a bunion to the left great toe. Okay. So what we recommended was, correction of the minimally invasive correction of the structural deformity in order to eliminate the symptom, which is a result of the structural deformity. The structural deformity is the hammer toe. The symptom is the ugly corn. So let's take a look here, Caesar. We'll start off by, presenting the bunion. Again, there was one little suture here. We were able to basically just, shave the unsightly bump, right? And this came out very nice. In addition, let's take a look at the fifth toe, and we'll definitely integrate the befores as well, so people can really appreciate the transformation. Tremendous hypopigmented lesion, both fifth toes. And not only that, again, we go back to what I like to call the shrimp, right? The toe is sort of on its side, and it's got the hammer toe deformity at the level of what we call the PIPJ joint, okay? Proximal interphalangeal joint, okay? So again, very important, looks really good. Nice and straight, the nail is straight. There's a saying in what we do that the nail never lies. Wherever the nail is, that's where the toe is looking, right? In this particular case, the nail's straight, toe is straight. And the same thing goes here. Sometimes, it could be a hybrid, what I like to call a hybrid case. Sometimes we can actually do a one little stitch procedure where we basically just shave the pebble, right? The pebble is the structural deformity, which is the cause of the symptom, which is the ugly corn. This particular case, we made we actually not only shaved the pebble, but we actually excised the corn as well. And as everyone can see, the patient, this is only 3 weeks after. On the left, you can barely even see the incision, and on the right as well. So again, no screws, no pins, no plates. Performed in our office-based surgical suite under local anesthesia. Patient walked in, walked out. I'll ask the patient just a couple of questions.
Sure.
How did it go?
Very well. Faster than I expected.
Okay.
As for pain,
On a scale of 1 to 10, 10 being the worst?
That was just I would say the first couple days, the first few days.
Okay, and now?
Now it was bare minimum.
Okay. So, listen. The world needs to understand that, it doesn't matter if it's the foot or the arm, the finger. Surgery is surgery is surgery. Pain is expected.
Right.
There's nothing that we can do about that. So, I always, we like to be very transparent with the entire world. There will be pain. Everyone is different. Usually it's the first 3 days that are, really the pain is really uncomfortable.
Yeah.
To whatever extent, right? Mm-hmm. Everyone is different, but the first 3 days is when they experience the most discomfort. After that, every day, pain dwindles away. But the nice thing is, again, when we look at, how do we hold everything, and believe it or not, this is exactly what we use, a little steri strip, and that's it. Just for one more week. After that, the patient's going to be. The patient really can actually go into close, comfortable shoes now. A lot of people will ask, what about high heels? Can I wear high heels? Absolutely. We're not fusing any joints in these procedures. Let me see what other questions a lot of people like to ask. That's pretty much it. You guys will definitely see the before pictures, and the transformation is definitely pretty striking, but everything looks really, really great. I continue to say it, in respect to the clinical presentations that we see here, in respect to the aesthetics and the aesthetic elements, the corn, the ugly corn, people are just right? They just don't like, it really affects, them on a very personal level. And we understand those elements, right? the embarrassment, patients or individuals not able to wear open-toed shoes. They don't want to show their feet, etc. So we understand those elements, and it's really important. It's something very personal. So I think this is great. It's a great case. It's a great case update. So, is there anything else that you want to say to the world, maybe?
I will say that this was by far, it went above my expectations, especially not going the traditional route and being able to stand here on week 3. So thank you, and I'm happy with the
you were
progress.
able to walk the day of the surgery.
The
after.
day of the surgery, I was able to walk out. Yes,
Okay.
that was surprising too.
As always, I want to take this opportunity to thank the patient, and always, Caesar. The whole world wants to know what Caesar looks like.
One day.
One day. As always, thank you for watching. Have a nice day.